Dr. Barry Taylor joins us, and I tell you, you have been just terrific during this crisis and this unprecedented time, and we thank you very much for that and for being with us every week.
Thanks, Ken. I love being on with you.
Well, let's talk about those people who are at highest risk to contract the coronavirus or COVID-19. Yep. And as we mentioned before the break, those with asthma, allergies, chronic bronchitis, COPD, those I guess would have to be among the highest risk group.
Yeah, and let's back up just for a moment, because it's, I think, easy to forget, or maybe people don't know. Lung concerns is the fourth leading cause of death in the United States. After cancer, heart disease, and strokes, what you just said, the combination of people dying of pneumonias, people dying of complications of allergies, which, people can be very uncomfortable with, but they don't think it kills you, people who have COPD, chronic obstructive pulmonary disease, people who have breathing problems called asthma that they just tolerate with inhalers, and then that develops into more serious things in their 60s, 70s, and 80s. So we're talking about people who already, before this particular virus that particularly targets the lungs, are already at risk. It's already it's not like down below. We're only talking about tens of thousands of people. We're already talking about hundreds of thousands of people, but that's their exit strategy for leaving their body. So dealing with people to understand, both before coronavirus, but especially in the face of coronavirus, what can people do to really keep their lungs stronger is an important question. How important a question? I just ordered a wholesale distributor because as you know, I distribute supplements for friends and family, and people call me, and particularly people that I individualize their nutrition programs for. And I was ordering zinc because there's been a lot of press. Yes, Ken, a lot of press about zinc and coronavirus. And it's like middle of May, end of May. Well, wait a second. There's only 20 or 30 or 40 different distributors who are different manufacturers. There's a lot of quality among herbs and different nutrients. Zinc happens to be one of those things where there's zinc picolinate, there's zinc, different forms, zinc citrate, zinc gluconate, and some forms of zinc are more or less absorbable than others. That's true. But so I was calling what I call a consolidator. This person, this company distributes lots of different companies. Got it? They have no zinc to sell me. Everybody's buying zinc. Amazing. So there's a lot out there about what people can do for their lung concerns. Let's quickly summarize this so people can start to think. Lung concerns are either infectious agents, right, like people have pneumonias, or unfortunately this new virus, or you've got chronic bronchitis and you've got either a bacterial or you've got a viral infection. Rarely, if ever, do people have a fungal infection in the lungs, the way people have fungal infections in the digestive tract or in your big toe or in other places. And people rarely to never have a parasite infection. So in terms of different infectious agents, different organisms, people can have viruses or bacteria. That's something we'll track in a few moments. There's also that people don't have what is called an infectious agent, but they're susceptible to dust. Yeah? They're susceptible to pollen or grass or molds. There's some chemical. They walk into a room of perfume. They walk into a room of odors or household odors or cleaning products, and, they get something. They get a headache, or they get dizzy, or they get coughing. So the inflammatory process that might be similar from an infectious agent, or the inflammatory process that could be similar from an allergen, is something we'll also talk about in a moment. But I want you to appreciate that it's either people who've been tolerating mild, moderate, or severe allergies for 10, 15, 20 years, and unfortunately somebody has said to them, you can't get over this, you just have to live with that. That's tragic. Or people who get frequent colds or frequent sore throats that sometimes move into their sinuses or sometimes move down into their respiratory, into their lungs. So there are things that are very, very important that you can do. Quick story. I'm in medical school 1974, 1975. I visit a farm in Arkansas. First couple of years in medical school was in Kansas before I finished my medical school in Portland, Oregon. And there's this Seventh-day Adventist. I am not Seventh-day Adventist, but a strict Bible group, and a woman named Charlotte Holmes. She was 87, 88 at the time, an MD, and her husband, 97 years old. They were wild. They weren't into homeopathy or herbs or supplements, but boy, were they into food. They were into old-time nature cures. They were Seventh-day Adventists who believed in food and organic food. And when I was there visiting them, they had a lot of very, very sick people, and she at one point said, "Come over here, I want to show you something." She put a white sheet around somebody who was there with severe lung problems and had been a chronic smoker for years. And not too long after she put this wet sheet on their body, the sheet turned a mild, moderate yellow. It was pulling the nicotine out of the body.
Wow.
In Asian medicine, some 6,000 years old, Yellow Emperor's Classic, the skin is thought of as a third lung. So one of the first things to consider is that when you're dealing with the lungs holistically, and I'm not talking mentally, emotionally, spiritually, I'm talking about looking at the body and how it works. You're also looking at the skin and the colon and the kidneys and the liver. How can we get the entire body in, again, going back to Asian medicine, they said that the lungs and large intestine was one channel of energy. So there are a lot of people who have lung concerns. They also have bowel concerns. Maybe they know they've been constipated. They only move their bowels every 2 or 3 days, or maybe they move their bowels every day. But what they don't realize is what they're moving their bowels today is what they ate 2 or 3 days ago. And not days or weeks, but months or years of that will mean that they're having an inflammatory process on the inside lining of the colon, which is also part of why their lungs are not working. So, tips. One of the things that people can do who have lung concerns, whether it's an infection or an allergy, is consider getting an air purifier for your home. Not something that traps, like a HEPA filter, dust, but something that's an ionizer or an ozonator. Because there are a lot of people who their homes, the odors in the homes are maybe not as toxic as if, you went to a dump or something, or you live next door to a gas station or something. But it's amazing how many of my clients who have asthmas and who have allergies and who have different concerns with their lungs, chronic bronchitis, when they start to get better air quality in their home, it's amazing how many symptoms can get reduced. There's a lot of things that produce mucus. So some people I recommend to decrease dairy or decrease red meat. That doesn't mean everybody should be a vegan, but there are certainly foods that will increase the inflammatory process, even if somebody's not allergic to dairy, even if somebody's not allergic to red meat.
Right.
If you're talking about strengthening the lungs, we were talking about walking earlier. We're talking about how do you get more oxygen in the lungs. And there are a lot of helpful things like use more cayenne pepper or use more oregano or use more thyme. Those are 3 kitchen herbs that really are great for the lungs.
What do you recommend to strengthen the immune system? I know there's no zinc available. You pointed that out, but what other vitamins or foods would help in improving?
I finally found some zinc. They don't have it in stock to send me, but they finally are going to send me some zinc in a week from now.
Okay.
So here are some of the nutrients, Ken. Thanks for asking. Rub your tongue on the inside of your cheek. What does it feel like? It's smooth, yeah? And we call that a mucus membrane. And the outside of your cheek, now if you just touch the outside below your eye, that's the outside of your skin. So the outside of your skin and the inside of your skin is called a mucus membrane lining. And so now we got the lungs that are kind of like the inside of your cheek. It's all mucous membrane. What vitamin is really key to mucous membrane lining health? Easy to remember. A for apple. So foods that are high in dark green leafy vegetables, carrots, squashes, that are beta-carotene, orange-colored foods, not oranges, sorry, but squashes and carrots that are beta-carotene will get converted into vitamin A. If you boil your string beans, if you boil your spinach, if you boil your broccoli, your vitamin A is going to be in the water. You see in the pot it's all green there. Well, you got now vitamin A in the water. You just boiled it out of the vegetable. So if you bake or broil or grill or have your vegetables more raw, you're not going to destroy the vitamin A. And a lot of people, when you look at their sun-damaged skin, or you look at their allergies, or you look at their frailty with getting sick, they don't need enough vitamin A. If you're talking about, well, what could I do from an insurance point of view, then you'd eat a whole lot more vitamin A-rich foods. You might do things like carrot juice, maybe, it's a possibility, and you'd be very careful to work with a functional medicine doctor or me or somebody if you wanted to take a vitamin A capsule, because vitamin A is one of those very, very few vitamins that could be toxic. True. It would take 3, 4, 6 months for people to take a huge amount. And in my 45-plus years of practicing, it's happened once out of several thousands, many thousands of patients that I've worked with. But in terms of the immune system, another one is an amino acid. Specifically, we're talking about lungs. There's something called NAC. The name of it's called N-acetylcysteine. And yeah, you could get it in grains and seeds and pumpkin seeds and almonds. But if you really want to protect your lungs, and you have some relative that's had emphysema, or you used to have lung concerns, but in this COVID universe you really want to protect yourself, then you could take 500 milligrams or 1,000 milligrams, comes in 500 milligram tablets, pretty inexpensive. Any NAC is probably the same. It's one of those few where the quality of it's probably not much different depending on who you get it from. And you've got zinc, you've got vitamin A, you've got vitamin, not a vitamin, an amino acid, NAC. Those are some of the real important things to protect the lungs from an immune point of view. Now, from an herbal point of view, there are all sorts of things, like green tea is really helpful. And there's an herb called pleurisy root, which is a part of a lung tonic. Or there's something called lobelia. The common name for lobelia is Indian tobacco. And those things can be either taken in a dry form in a capsule. You could find those things in a lung tonic that's not liquid. Or someone like me buys them in quarts or half gallons, and then I'll put a little of this and a little of that and a little of this, depending on, does somebody have a dry cough? Does somebody have any mucus? Is somebody getting phlegm? Is it white? Is it yellow? Somebody has no symptoms, and I'll make up a 2, 3, 4 ounce bottle that somebody would take 3 or 4 times a day if they had symptoms. If somebody didn't have symptoms but they wanted to take it preventively, then they might take it once a day. They might take it 3, 4 times a week. So there's certain herbs that are respiratory tonics. There's something you could get at CVS or Walgreens or Target. You say Target in New Hampshire?
Target, of course we do. We're very sophisticated up here.
It's the French-Canadian influence from Quebec. Yeah. So there's something called guaifenesin, Guafenesin, guaifenesin. And it used to be something that herbalists and, naturopaths and natural practitioners like me would get. But then somebody must have caught on. Because now it's not, you don't have to get it from somebody like me, and it really is amazing for cutting down mucus. It's sold under the name at some drugstores, Walgreens, I've seen it at CVS, Target. It's sold as something called Mucoplex, and the active ingredient in it, Mucoplex, MUCO plex. Mm-hmm. And the active ingredient is this guaifenesin, which I've used when people have a lot of mucus, and you really want to cut the mucus, you want to cut the inflammatory process, whether it's from an infection or an allergy. But when you're working with somebody like me, that's really what you want to look at. Because if somebody has had a fair amount of strep or a fair amount of different other viruses, not COVID, and they want to say, my lungs are at risk, going out for a walk, oxygenating myself, let's see, I don't have a cold or hot sheet treatment. Dr. Holmes is probably long gone, God bless her. So I can do hot and cold showers, or I can't go to my health club and take a steam or a sauna. But in my shower, I could really sweat, hot, cold, and get it's called vascular gymnastics. Mm-hmm. So there are different ways that if somebody has dust or pollen or trees or grasses, I would say, here's a couple of other herbs. I use them in my Love Your Body supplements. One is called pine bark, and another is called grape seed extract. Those are particularly if someone's got allergic symptoms, not infectious agent chronic bronchitis symptoms, and it's going to make them less symptomatic. And the less symptomatic, that's not getting rid of their allergy. That's a different process we can talk about at another time. But the less irritated the lungs are, Ken, then the less susceptible someone's going to be for that virus to grab. You know, the more mucousy somebody is in their nose, the more mucousy they are in their lungs, then that's how the droplets or any infection gets embedded.
Now, you said pine bark and what else?
Grape seed extract.
Okay.
They're part of in my Love Your Body line. They're Healthy Allergy 1 and Healthy Allergy 2. There are different formulas. I'm not the only company that makes pine bark. I'm not the only company that makes grapeseed extracts. They are two wonderful herbs that are about mitigating inhalant allergy reactions. And let's also throw in vitamin C. But you can't take a little bit, Ken, and you probably are not going to be taking ascorbic acid. You're probably going to be taking some buffered C, because if you want it to really help neutralize infections and you want it to help neutralize allergic reactions, you're going to probably be taking 2, 3, 4, 6, 8 grams. That's 2, 3, 4, 6 thousand milligrams.
Yeah. That does not mean to drink a ton of orange juice, though.
It's about 100 milligrams of vitamin C in fresh squeezed organic orange juice.
Right.
There's
fresh squeezed, yes.
Yeah, there's almost no vitamin C in pasteurized, I won't mention any names, of pasteurized orange juice that you get in any store. Wherever you get it doesn't make any difference. If it's been exposed to high heat, there's no more vitamin C there. It's gone. It's fractional. Even though people say, I should get my, brand that starts with a T. Everybody buys it. Yeah, but it's been frozen or it's concentrated. And vitamin C, different than a lot of, like zinc isn't heat sensitive. Vitamin C is heat sensitive. So, you couldn't do enough orange juice. 10 oranges that are organic, if you juice them, would be 1,000 milligrams. And if someone's got a dust or a pollen or a tree or a grass allergy, they're probably going to need 2, 3, 4, 6 grams of vitamin C. That's 60 oranges. I don't think that's happening.
Yeah.
It's not going to happen.
Well, unfortunately, Dr. Taylor, we're going to have to leave it here for the day. But always great information. I know I'm taking notes. I'm sure people at home are taking notes. I hope you're not if you're driving. But nonetheless, a great segment again, and we will look forward to another one hopefully next week.
Great. I've got my Love Your Body kicking off next week, so maybe you and I can do a talk on how detoxing strengthens the body to really be a huge fortifier to not have viral infections. We can look at when we might do that. Great.
Outstanding. Sounds great. Dr. Taylor, stay well, and we'll talk to you soon.
Thank you so much, Ken. God bless. Take care. Bye.